Today we are going to raise some awareness on the over-the-counter drugs. So we all know FDA regulates everything pretty much, whatever drug we take in the country here. But do you know how the FDA came into existence? Well, back in 1909, we had a law or an act. We called it Food and Drug Act. And that's when that was enacted, and we had the formation of FDA. But the problem was anything could be sold over the counter, anything, whether it's opioid, whether it is alcohol, whether it is narcotics. You can just make any dosage form, put it together, put it in some bottle or capsule, and just sell it over there. So we did not have any regulation whatsoever. So we had amendment then. We had the formation of Food, Drug and Cosmetic Act in 1938. But still we had some loopholes. People would, how the manufacturers and companies are, pharma companies are, they just have a way to just, work around the loopholes, and they sell and do whatever they want to do. And we saw a lot of abuse, a lot of deaths, a lot of mortality with the drugs which were just sold without any regulation whatsoever. So in 1951, we had what we call Durham-Humphrey amendments. And that was the first time we actually heard the term called prescription drugs and non-prescription drugs. So the prescription drugs were behind-the-counter drugs. You have to have a valid script from the doctor to get any medication. And then we had non-prescription drugs, which some could be behind the counter as well. For example, vaccines, you don't need a permission from a doctor, but you still have to show your ID and have some paperwork to do. So it's behind the counter, but still over the counter. Over the counter means you don't need prescription. Anything which is there on the shelf, you can just go get it. So that's what over-the-counter drugs are, usually. Do you know what are the different over-the-counters that we have if we divide them in various categories? The first one that comes to my mind is for pain, fever, gastric problems, and seasonal allergies. So those are some of the common categories, and we all take them. And the problem is some of the over-the-counter active ingredients that we get over-the-counter drugs, they're part of the prescription drugs. So we end up taking a lot of extra dose of those substances, or we call it active ingredients in pharmaceutical term, and that's when the problem arises. When you take too much, that's bad. Anything you study too much, that's bad for your exam, right? Similarly, if you don't study at all, that's bad too. Similarly, if you take too much drugs, even though they're over the counter, they're bad. And if you don't take it all, you're going to have whatever your condition you're having. So let's look at some of the criteria. Once we have the over-the-counter drugs law established, then they said, well, a drug in order to be sold over the counter has to fulfill some criteria. And the number one criteria was that patients should be able to self-diagnose. If they know, okay, I have cold, and it's not something bad, it's just a regular cold that I get with the change of the season, then they should be able to go over the counter, identify a drug which suits them and helps them to treat that cold. So the patient should be able to identify themselves what exactly the ailment is, and then they should be able to get the drug over the counter by themselves without the intervention of a medical doctor. The second thing is, because the patient is self-medicating here, so the important thing is the patient should be taking the drug which should have decent safety profile. By that I mean that if you take it in a normal, not prescribed, but standardized quantity, it should not cause any issues. It should not cause any adverse effect. It should not cause any side effects. So it should have reasonably safe adverse profile when it comes to over-the-counter drugs. And then the third thing is, it should have proper labeling. So when we say proper labeling, it means what it is used for, what is the intended clinical application, what are the active ingredients, what are the inactive ingredients. So do you know what inactive ingredients are? Or excipient, we also call them. Well, let's say we have a pill of acetaminophen, right? So it will have a binder. which binds together the active ingredient. Active ingredient is what? Acetaminophen. But it also has nitrocellulose. If it is in a capsule, it would have some, whatever that they use gelatin to make the capsule. So all those are called inactive ingredients. So it should have a thorough explanation of inactive ingredients there. What are they? And you should be aware, if you are taking those drugs, that are you allergic to them? Do you have any bad effect in the past just because of the inactive ingredient? So these things you should know ahead of the time. So, and then warnings. Are you taking any prescribed medications that it can interact with and cause problems? Drug interactions are very common. If you take over-the-counter, for example, Tums, antacids, if somebody has thyroid-related issues, and if they are taking, for example, thyroxine, I don't know if you know it, but antacids can cause a delay in the absorption of those drugs. If somebody has already kind of, let's say, constipation or bloating issue, and if you're taking Tums, obviously it's going to exacerbate that. So you have to make sure that whatever you're taking, it has safe adverse profile, and it should be there. It should be there on the label itself, what drug interactions. And you should never hesitate asking the pharmacist, even though it's over the counter. But if it's, of course, if you're taking at a gas station, nobody's there to help you with it. But if you're taking at a Walgreens or whatever pharmacy, you can just ask the pharmacy, hey, I'm having this issue, and I have been taking this medication for some time. You think it will be good if I take this along with that medication? So you should always have that in your mind. And then the storage conditions. We all have medical cabinets in our home, in bathroom and somewhere, and we transfer those medications over the counter into very good looking containers. I do. I don't know about you people. But that can change the storage conditions, because we don't know if it needs the amber color container or if it is a plastic and it needed glass. Is it going to cause any impact on shelf life? We don't know that. So it's important not to change the storage conditions. Keep it in the original container in which the medication came. I don't know what happened. It's okay. And the directions. If you are supposed to take it with water, take it with water. If it's a chewable thing, just chew it. Or if you are supposed to take it exactly without breaking into pieces, don't try to triturate it. So just exactly follow the direction of use. If it says take 2 pills 2 hours apart, or if it is acetaminophen, for example, the overdose is 4,000 milligrams in 24 hours. So if you take more than that, it's going to cause problems. So you follow the directions to the T. Even though it is over-the-counter drug, but remember, everything has the potential to harm you. Any drug. If it's in abnormal quantity you take it, it's going to cause problems. And if it is, you're not taking in the due dose, it will be subtherapeutics. It won't have any effect. Because of the consumption of over-the-counter drugs, it helps patients that, you will be physician at some point and they won't be calling you for every single thing. It would ease some pressure on you, and it also helps patients for cold, for allergies, for diarrhea, or for minor pain or fever. They don't have to ring your office up every single time. So that led to the massive consumption of over-the-counter drugs, and as you can see on this chart, over the years, if you look at the last 6 decades, there has been exponential growth in the manufacturing of these drugs. Look at 2011 to 2021, $32 billion. If you want to be an entrepreneur along with being physician, you should try run a pharma medication company. It's very lucrative business. But because so many people have been buying these things, these pharma companies are trying to push so many prescription-based drugs and trying to push them and switch them to the over-the-counter drugs. And this is just few examples that I was going through. I was looking at in the last 10 years, what are the standout drugs that were once upon a time prescription-based, and now they are over-the-counter, and I was surprised to see proton pump inhibitors there. Omeprazole, esomeprazole, they used to be once upon a time prescription-based. Now they're available over the counter. And they're very antihistamines here as well. Allegra, I think you all have seen the advertisement of Allegra on TV. Allegra Plain, and Allegra D. D has pseudoephedrine along with it. So those things are, they have their own effects. If you take too much, it's going to cause problems, and I'm going to discuss some examples later on. Even nowadays, steroids are available over the counter, glucocorticoids. In Nasocort, which is for the congestion, if you look at the ingredient, it has triamcinolone. Triamcinolone is a glucocorticoid. So do you see now the steroids are also available over the counter drugs, inhalational form, topical, you name it. So there has been this push of trying to convert as many drugs as possible in over the counter form, and they just play with different dosage forms. So if they think, the research says that the abuse comes from, let's say, snorting it, make it a gel or make it a topical thing. But somebody who want to cheat, they can cheat no matter what happens. Similarly, the addicts, they do whatever they have to do. So they find ways just to come around it. But these are some of the examples that I found very fascinating in the last 10 years. And now they are over-the-counter drugs. And in the last year itself, these were the top 10. I mean, there are many here, but these were the top 10 consumed or sold over-the-counter drugs. Look at the categories: analgesics, internal and external. External, for example, lidocaine spray, or the cream, topical cream. And analgesics, NSAIDs, ibuprofen, aspirin, all those. Decongestants, as I said, Allegra, for example. Female contraceptive, levonorgestrel, that comes to my mind right away. Antidiarrheal, we all know Imodium or Pepto-Bismol. You had that in your case yesterday too, right? Pepto-Bismol. What does it contain? Bismol means bismuth, yes, bismuth salicylate, subsalicylate. And Imodium, how I would remember is Imodium. It's a brand name, you're not going to be tested on it, but still, it's immobile the gut, so it's antidiarrheal. It's loperamide. And then we have anti-smoking, so many anti-smoking medications available. Heartburn, antacids, for example. Not only antacids, but also the H2 receptor blockers, ranitidine, famotidine. Zantac was recalled last year. Do you know that? Zantac. And did you find out what was the reason for its recall? It turned out it had a substance in it, inactive ingredient, not the active one, which was carcinogenic. And they knew for a whole 6 months, and they just sat on it. Even after the FDA issued a very stern warning, recall it back. They didn't do it for 6 months. And imagine how many people would have been affected by it. Zantac is pretty much, most people who are in middle age or even younger who consume a lot of coffee, they have gastric issues, they have heartburn issues. So it's ridiculous, the greed. But anyways, I'm not here against anybody. I'm just here to, caution you that when you're taking these medications, there are some side effects, even though they are not prescribed. They are just freely available. So some of the dangers that come to my mind, if I not only the prescription-based or non-prescription-based medications, but anything. Every drug, if you take in large quantity, have the potential to cause harm, and they can have neurological effects. For example, it can make you dizzy. It can, just make you unsteady. You can't walk, or you feel wobbly when you're walking. You feel you're in motion. You have vertigo, or you just don't feel good. You feel you're gonna faint. So it can be pre-syncope as well. So all those things. And then there are some drugs over the counters which can make you feel hallucinated. Hallucination is very common. If you do, go crazy and take a lot of, for example, dextromethorphan. If you take a lot of dextromethorphan, it can cause hallucination. And hair loss. Hair loss is, obviously if you're losing weight and you have hair loss, you need to see a doctor. But in general, if you're otherwise healthy and you are taking some over-the-counter drug and you see there's a hair loss, most likely it's the time to rethink about what you have been taking over the counter. Then there are some other hypersensitivity reactions you can have. Type 1, type 2, type 3, anything. Hot flashes. Even sometimes you may have blurry vision, and you never notice if you have, for example, some existing eye condition and you're taking something which you're not supposed to, because we have a tendency to do everything at a very fast pace nowadays. So if you go to pharmacy, you want to get an eye drop or eye tear for lubrication, and you just get whatever brand you wanted to get, and that's it. Well, you have to just stop a little bit, look at the expiration date. What if it has been expired? Pharmacy don't care. Whatever is on shelf unless and until it is sold. They are not going to replace it with anything. So you really have to take that moment, look at what is there inside it, what are the warnings, and particularly the expiration date. And even though if it is not expiring in the immediate 6 months, but once you buy it, it will be at your home, and you might keep it for 6 years or 5 years, and whenever you have a problem, you just go and get it. So it's going to exacerbate your eye issue. It can also be very unhealthy. It can develop certain eye conditions that you otherwise won't have. So you really have to watch out for the expiration date particularly, and anything, whatever the label has to say. Just don't take it for granted. And then of course it can cause menstrual irregularities among women. So these things you really have to take into account. That it can cause so many side effects. Let's take an example of Tylenol. And yesterday, as a matter of fact, for this presentation, I was looking at the data of the emergency department, and I was surprised to find about 80,000 per year we have admissions in the ED just with liver toxicity induced by this Tylenol, Acetaminophen. Can you believe it? Just over-the-counter drugs. I was shocked. And then I started to realize how many formulations do we have over-the-counter and prescription-based which has acetaminophen in it. More than 400 products. More than 400. So let's imagine if somebody on an opioid medication for pain management, and they are taking hydromorphone along with acetaminophen. So hydromorphone will be 5 milligrams or 2 milligrams or 10 milligrams, and they combine that with acetaminophen, which will be 350. So you have that, and then you feel decongested, for example, and you're also having allergy, and you buy a product which contains, let's say, Tylenol again, acetaminophen, along with pseudoephedrine or dextromethorphan. Imagine if you're taking that along with whatever medication you're taking. You're just doubling up every single time you're taking that over-the-counter product. And eventually it can cause liver disease. And there are risk factors if you are older, or if you have some chronic liver disease, or you drink too much, maybe 3 drinks a day, you are at risk factor of developing that liver problem. So it's not healthy. And sometimes you may end up having to require a liver transplant. So this is, I knew some of here will be our students, so I just put this diagram here. It's more pharmacological. I don't want to go over the mechanism, but it's there in the picture. Acetaminophen is very good in terms of metabolism. 90% of it is converted into non-toxic products, but about 10% or so gets converted into a specific compound. They call it an acetyl para-aminobenzoquinoamine, and that is an active metabolite. It means it can on its own, it can interact with the tissues and damage them, or it can be further converted into free radicals, especially 4-aminophenoxy free radicals. And that can cause, you know what free radicals do, oxidative damage, eventually necrosis, all of those things. So if you take too much of that, it's difficult for for your antioxidant pathway, which is already there in your body, to cope up with the increased amount of acetaminophen that you have been pumping in. So it's a problem. How can we overcome it? Take an antidote. What is the antidote? We have some second years here as well. No pressure. Yes. What did you say? Glutathione? Yes, and how do you increase that? That's the concept is right. That is also available over the counter, by the way. And acetylcysteine. Is that right, Dr. Fulton? Yeah. And acetylcysteine is what? I mean, they can ask you that on board exam, though, by the way. It's important. But as I said, we are not going to talk about the board exams today here. So these are some of the risk factors I've already talked. Nutritional, somebody who has, is immunocompromised, have nutritional challenges, age is not on their side, or they have some genetic dispositions, they consume alcohol too much, or they just have chronic liver illness. Obviously it's not going to be advisable for them to take acetaminophen in the first place, or even abuse it, take abnormally high dose. It's not recommended. Let's look at some of the other potential, not only the liver issues. Sometimes we see nowadays in this age of addiction, we see a lot of abuse potential of these over-the-counter drugs. There are so many drugs over-the-counter that have been sold have the potential to cause addiction. Addiction leads to abuse. Abuse leads to negative deleterious effect on your health. So, if these patients are taking over-the-counter over time, they can become socially withdrawn. Their performance, both in school and at work, in their personal life, professional, it can come down. You will see obviously noticeable changes in their personality, and sometimes they suffer from slurred speech. They're stammering. They never used to have that problem before. Now all of a sudden they have that. They feel depressed. They feel not motivated at work. They're not eating as much as they're supposed to, or they're losing weight. So, those are some of the typical symptoms you see if somebody is addicted or suffering from withdrawal, or are just into the thing what they are doing. And they don't have to be a hardcore street drug consumer. They could be just taking over the counter, unbeknownst to them that it has the potential to cause addiction. So sometimes it's not even their own fault. They don't know. Public doesn't know much. Very few people get into the medical school that you are, so not everyone is very aware. That is why we do programs like this. Well, this is just an example of a formulation called Robitussin or Dayquil, even Anquil, whatever it is. They all contain dextromethorphan. And in 1960s and 70s, they pulled it from the market because of this potential abuse issue. But then they reintroduced it back. They said, oh, we are going to make it untasty. We're going to change the taste, make it bitter, and and that will help. Yes, they made it bitter. The sales little bit went down, but then a few years later, slowly they added sugar in it, made the taste better, and now they're back up again. That's what they do. As you can see here, it's currently available as syrup, lozenges, capsules, spray, you name it. All kind of dosage forms available. And they're often used or misused because they can act in your body like angel dust. Have you heard the street name angel dust, Maria? Yeah. Phencyclidine. Do you know the mechanism of action? I know. Once a pharmacologist, a teacher, always a teacher, right? Do you know the mechanism though? Well, it acts on brain, so something in the brain it acts on. What receptor? NMDA receptor. So it acts on it, it blocks it, and then it decreases the cough reflex. But if you do it too much, obviously it can cause euphoria-like symptoms, seizures eventually, and brain damage. Very much like, and hallucination. And that's what people who get addicted to, over time they don't realize they're falling into addiction, and now they are so much used to that euphoria and hallucination that they keep taking it. They take it in all dosage forms. Sometimes they make their own recipe that I have to have this much syrup, this much lozenges, this much pills. I'll make a concoction of it and drink it. It could be, a rabbit hole, difficult to get out of.